Good morning to you once again. Thank you so much for being with us in Friday's edition of Morning at NTV. I am Priscilla Regina Naloga, and this morning we're going to be taking note of the health sector. We're going to be looking at the healthcare exhibition, the second of its nature, and we're going to be looking into the Pharmaceutical Society of Uganda. Privileged to be joined by our guest, who's Dr. Edson Ireta Munanura, Secretary to the Pharmaceutical Society of Uganda, to give us more enlightenment on what they do and what's their mandate in existence and what this exhibition is going to be bringing in terms of innovation and creation as far as the pharmaceutical end of the health sector is concerned. Good morning to you, Doctor, and you're most welcome.
Good morning, Priscilla, and good morning, Uganda. I'm happy to be hosted here at Morning at NTV.
Okay, so tell us about the duty and the work of the Pharmaceutical Society of Uganda.
Yeah, so basically the Pharmaceutical Society of Uganda is the professional body for pharmacists. It's established by an Act of Parliament, the Pharmacy and Drugs Act 1970. So basically we regulate the practice of pharmacy in Uganda. We have a council of 12 members, two ex-officials, the secretary and treasurer. So I'm the secretary currently. Then we have 10 members of council, of which 6 are elected by the AGM and then 4 appointed by the Minister of Health. So basically we're a government agency.
Okay.
Yeah, so we regulate the training of pharmacists in the country. Then also internship, we supervise internship. Then we allow our members, or we give our members any membership certificates that allows them to practice.
And that's on an annual basis.
On an annual basis.
So you renew it on an annual basis.
Yes.
Why is that so?
Yeah, because that's what the law says, that on every 1st
what
of
was
July,
the law trying to protect in doing that?
It's a quality check so that you're sure that the member who is out there providing services to the community has improved themselves in terms of competence and does not have any ethical issues against them.
Okay. Yeah,
so basically currently we have around 1,700 members. And what the other things we do is we promote research. Like currently we are raising a 4-level building to house a world-class laboratory to do product development and also do pharmaceutical analysis. Okay. Yes.
Now, as the society, do you cater for both human and animal pharmaceuticals?
Yes, yes, yes. A drug is a drug. The molecule is the same, it's just the formulation that differs. So we deal with humans, and then we do animal health and then human health. Yeah, basically.
Okay.
Yeah, so we have our members basically in the retail pharmacies and wholesale, whether they are veterinary or human. Then we have them in manufacturing, we have them in NGOs doing supply chain, we have them in clinical setting in hospitals, and then we have them in warehousing like JMS, NMS, then regulation like National Drug Authority, and then the manufacturing industries, which you know very many, like KPI, and then Abacus, and Cipla and the likes, and Jenna.
Okay,
that's the COVID.
So now that brings into question in terms of those that are in manufacturing, distribution, as well as dispensing. Yes. How do you actually monitor that chain of pharmaceutical?
So what we do is that for us at the Pharmaceutical Society of Uganda, we give our members a certificate of practice, sort of, it's an administrative document, which indicates where the member is going to work. So the member tells us, I will be working with this organization. Then we have the National Drug Authority, which regulates the product and the premises. So we work together. So the member joins the pharmaceutical company with an industry and then provides a service and is supervised by the Pharmaceutical Society of Uganda, but then what he's doing, the product and the premises are regulated by the National Drug Authority. So we work together.
Okay.
Yes.
All right. So you do have the Pharma and Healthcare exhibition. Yes, this is the second edition. Going back to the first edition, what were the gaps that you were trying to fill when you came up with this initiative?
Yeah, so basically the pharma, medical and healthcare sector is rapidly growing. You can't be sure what's out there. When you are, the Uganda part of the child who doesn't visit thinks the mother is the best cook. So a lot of things come up. So we thought, let's create a platform, because all the other exhibitions are not specifically about the pharmaceutical and healthcare sector. let's create a platform where we can have exhibitors from all over the world and then from Uganda come together, network, look at new opportunities, explore, you know, connect, collaborate, and learn from each other so that you know what's new out there, and then also what equipment is there, what diagnostics are there, and then, you know, build your own capacity or through raising capital on your own or collaboration. So looking at the broader aspect of improving what we do in terms of product development and then diagnostics and the whole spectrum basically.
Okay.
Yeah.
So give us the details of the exhibition itself.
Yeah, so the exhibition, which is the Uganda Pharma and Healthcare Exhibition 2023, is going to take place on 16th to 18th February 2023 at Commercial Grounds, Lugogo. Yeah, we're expecting to get around 115 companies coming from the rest of the world. In this case, we're talking about Asia, Middle East, North Africa, USA, and then the rest of East Africa. And from Uganda specifically, around 45 companies. And we are looking at pharmaceuticals, we are looking at medical, healthcare, we're looking at surgical, dental, and then diagnostics, and then herbal and Ayurveda. So the whole spectrum of products within the health sector, basically.
Okay.
Yes.
All right. Now, in that very same regard, I know that it takes partners because it must be an expensive venture. Yeah. So do you have partners that have come on board to help you support and do this?
Yeah. So basically, pharmaceutical side of Uganda, the line minister is Minister of Health. So we are supported by the Minister of Health and then work closely with the National Drug Authority, and also the other support we've gotten from Uganda Medical Association, then Uganda Manufacturer Association, and then Allied Health Professionals Council. So those are the ones supporting us this side.
Okay.
But then the main organizers, Pharmaceutical Society of Uganda, and then the Exhibition and Trade Services India. And then the key sponsors for this event, we have Bliss GVS Pharma, and then we have Onen Laboratories, and then MTN Mobile Money.
All right.
Yes.
Now, you had the first edition. How different is the second edition from the first one? What are you more intentional about this time around?
Yeah, the first edition was, you know, try out and see how it goes.
How was the response?
And we didn't get a very good turnout, you know, on the first. Of course, that time we had COVID vaccination, so NMS was there. Then we had the free eye checks from Dr. Garaus, and then, but the people didn't come out because most people didn't know that it's free for starters. That you know, to come and see, you come, it's free entrance. So now we are pushing that to let people know that no, coming for the exhibition, you come, it's free entrance, and then you're able to see that. Then also we had not, you know, had good interactions with the other healthcare or whatever health professionals, their organizations. So now we've engaged the Uganda Medical Association, and then we have Allied Health Professionals Council on board, and we have also engaged the Nurses and Midwives Council. So now we learned that if we engaged our colleagues from the medical fraternity, then because most of the things actually, most of the things that are going to be exhibited are targeting those people.
That's true.
Yes.
Okay.
Yes.
Now, speaking of targeting people, who's eligible to come? What's the criteria of invitation?
To exhibit or to see?
To exhibit, and both exhibitors.
Yeah,
and those
for the exhibition is about anybody who has a product that's around what we're talking about, whether they are medicines, whether they are medical devices, they are diagnostics, you know, you have your herbals and other Ayurvedic products, and maybe you're dealing medical equipment, surgical equipment, dental equipment, orthopedic, and the like. So anybody within the health, supporting the health sector in one or the other by having a product or something out there. So all those ones are eligible to come and exhibit, but of course the exhibition fees.
Okay, and is there still room for people to sign up?
Oh yeah.
Please.
The room is still there. We have packages. We have general, which is 4 million shillings. Then we have bronze, which is 10 million. Then silver 15, and then gold 20. So it comes with different privileges. But of course, you would get a 9 square meter booth for the gender and bronze, and then 18 square meters for the silver and gold. And then of course, the other opportunity that come is that we are able to promote you on our social platforms. Then we have a catalog at the show, and then we also have we shall have a mailing list of people who will come, and therefore we're able to send out emails about your products, and then also the promotional materials for those ones who are supporting us, be able to appear on all the other promotional materials.
Okay. So yes. Speaking of promotion, what are you hoping that the second edition is going to address in terms of promoting pharma and healthcare?
Yeah, usually the big thing we look at is, one, people need to know that your product is there. I mean, the opportunities, for example, people want to invest in Uganda, but they need to know that somebody is doing something. So that is the biggest, that you show out Ugandan companies able to show what they have, show their abilities, and then somebody can start from there and say, okay, let me partner with this one and build this to a big level. So that's what we are looking at basically. Okay. But we have, like, in terms of why people should come and why they should participate, we have 6 reasons why people should come and participate. We call it CCERNU. That come and connect, come and collaborate, come and explore, you come and reform the way you do things, come and network, and then come and update yourself, see new things out there. For example, we have people who are coming, the companies, and they deal with medical tourism. Somebody may want to know, when I go, if I have an issue, I want to go to India, what is the process? Maybe for the transplant or for this other surgical operation. So those are the opportunities out there that we hope that we shall tap into. So actually our theme is unleashing the untapped potential of the pharma, medical and healthcare sector in Uganda.
Speaking of medical tourism, yes. I know that it's majorly understood as someone who has, you know, a health predicament and they have to access care from elsewhere, majorly the diaspora. Is the reverse getting better for us as Uganda? Are we getting that environment in terms of proper, professional and up-to-date kind of technology and equipment that can have other people from other parts of the world come to Uganda to get medical care?
Yeah, I think when you look at it, you know, you have to have baby steps. If we looked at Uganda, for example, we have for Tanzania, Rwanda, DRC, Ethiopia, people come here actually to get those services. But then also through the promotions, now we've seen that instead of people needing to go out there and meet the specialists have started to come. I know you could have received some messages where they say, this specialist is coming to Novik, this one is coming to Kasero Hospital. So we hope, actually one of the reasons why we have this expo is we shall have also hospitals, I know, exhibiting. So when people come and they realize, oh, there's this hospital, and then they can partner, and then instead of people needing to go out there, then we build capacity here, and then we have some of those operations done here. So it is improving.
Because I saw one of the most recent additions to innovation with IHK. They're doing fibroids non-surgical treatment, and I thought, wow, that has come timely when you're having so many fibroid cases mushrooming left, right, and center. So I believe that this exhibition is really having good intentions. Now, in regards to there's medical, there's equipment, there's diagnostics. Now, what is our strength as a country?
For the pharmaceuticals, at least we have now 43 companies doing production of essential medicines, beginning with, you know, the paracetamol, the methylmephantrin for the malaria, so meeting the basic needs. So that one, we're doing well. We are now, at least we have East African Medical Vitals, they're part of our partners, they are producing gloves. So we are improving there. Now, Joint Medical Stores, also our partners, are doing medical oxygen. Remember during COVID, the issues we had with shortage of oxygen. When we had issues here, Dr. Gwang with Jena Herbals, who are also our partners, were able to come up with Covidex. So that is from the herbal side. So we actually have partners. We have partners from Uganda, Herbal Association that are also going to be part. So we are improving in that sector in coming up with the drugs, then the diagnostics and equipment. And people have been actually working on diagnostic equipment, for example, diagnostics for Ebola, within Mulago there and all that. So we are improving, baby steps in that area. And then we hope that this can be accelerated as we keep on having the networks and all that engaging.
Well, thank you,
But of course,
Edson.
takes a lot of capital, so that's why
true.
the collaborations are always good.
Okay.
Yes.
In your final remarks, and now focusing on the exhibition itself, how can people reach out to you? Where do they get this information? More so, how do they get to be directly a part of the exhibitors, those that are interested?
Okay. The Pharmaceutical Society of Uganda has its own home in Ichambogo, Banda. It's called Pharmacy House on 1 acre. So we're available there. We have a website, psu.or.ug, and we have a contact there, 0785 423 205. Then we have our other people who are doing the promotion as part of the exhibition and trade services India, and that is Beatrice on 0757 388 481. So members are able to get to us. Also at WUMA, we have because we are working with the Uganda Manufacturer Association, so if you approach the WUMA office, then they also get a person to us, and we're able to onboard them.
All right, yes. Dr. Edson Ireta, thank you so much for giving us that enlightenment about the Pharma and Healthcare exhibition that is coming up next week from the 16th to the 18th of February 2023. Make it a point to be there and receive some of these services and checkups free of charge. This brings us to the break, and we're going to be taking a breather. When we return, Postscript is going to be looking at Somalia knocking at the door of the East African community. Do stay with us.